Good job, zombie. Good job, people. Good job. Those other ones are hyperglycemia.
I didn't know that was.
It's almost all of these are select all, so just letting you know. It did say multi-select, but that's okay. That's okay. Okay. Hocus Pocus. That is a cute movie. Alrighty, so irritable is more about the hypoglycemia than it is the hyperglycemia. So just, I know that sometimes, some of these kind of go both ways, but irritable is more about hangry. My husband's diabetic. I'm gonna be talking about my husband and my father-in-law for like the whole rest of the whole time because they're both diabetic. So yeah, my husband, I had this sign, I bought this sign that said hangry and then it has a definition and it's in his bathroom, on his side of the bathroom. So yes, he definitely is irritable when his blood sugar's low. Ooh, Peter Pan. Multi-selected. Alrighty, so yes, so aldosterone, it was just a hormone that I picked. It has nothing to do with glucose regulation.
Well, I definitely did not read that right.
It happens. So cortisol, that's our glucocorticosteroids. We know that with stress inducement is the reason that your blood sugar will rise. And then glucagon, obviously, it's rises. And then insulin is important with glucose control, but it's the opposite. Candy corn. I don't like candy corn. I like chocolate things. I don't like sugary things. Okay, so yes, it's an all. So I just kind of mentioned coping when I was talking about the glucocorticosteroids because our stress, makes our glucocorticosteroids rise, which can definitely affect our metabolism. So coping is very, very closely interrelated concept. It's just not it's a psychosocial interrelated concept. So mobility, obviously, the more we exercise and whatever will affect our metabolism. Perfusion, we have to cycle all of our stuff around, and then our fluid electrolytes, as we know, the osmolality and different things affect our metabolism. book it says 24 to 28, but so, and what do we do when we check, how do we screen for diabetes? For gestational diabetes? Yeah, the OGTT or whatever that stands for, oral glucose tolerance test. Here we go. All right, perfect. That tells me that, I'm sorry. That's like a old school. That was probably, yeah. Okay. I'm from Tennessee. Well, what's antepartum?
For moms? That's.
Well, good for you, whoever got it right, good for you. So, yes, so these moms may have to be on insulin, during their pregnancy. First off, you always go with, nutritional, modification for anybody with any sort of, diabetes. But then fetal surveillance is very important, because what happens to our babies if we have gestational moms? Big babies. Big babies, they're like raging with sugar when they come out of their mom. So, yes. And then you have a higher chance of cesarean section. We try not to have those big babies. I wouldn't want to, let's put it that way. Oh, that means with diabetes, with gestational diabetes. Okay, so basically, nutritional modification when we're having the baby is not a component of treatment, because we're actually having the baby at that point. That's intrapartum, this baby is being born. So they're basically NPO. But, so they may be getting, insulin on that delivery day, but you'll definitely be checking their glucose hourly because of all the stress and everything that's going on. And you generally will avoid any dextrose solutions unless for some reason they are getting low, then you would, but as a general rule of thumb, you avoid the dextrose solutions for moms that are delivering, that have gestational diabetes. I'm sorry, I didn't put gestational diabetes in any of these questions, but it's all related to gestational diabetes of moms in different areas, just so you know. Sorry about that.
It's like,
I got one.
I don't know what's going on.
I got it right.
Oh, I see, I'm sorry. I said almost all, it was.
it don't even let you change
So-
your mind.
Most of these moms, the majority, if they just have gestational diabetes, will go back to being non-diabetics afterwards. But there is a huge propensity or a huge risk for them to become type 2 diabetics later on in life. Because basically, your body is stressed, and when your body was stressed at this time, you ended up with diabetes. Same thing that will happen as you age, your body will get more stressed and you'll go back there. But you reassess them to see if they actually have type 2 diabetes 6 to 12 weeks after delivery. Oh, I'm sorry, I was thinking about something, that's why I didn't hit skip. One of those answer choices said hourly glucose checks. That's why it's wrong. So be sure when you're looking at test questions, you see, oh, glucose checks, that's the right answer. But be sure that if there's a time on there, make sure that's realistic. So someone for the 6 to 12 weeks after delivery, you're not gonna hourly check their glucose. Maybe immediately postpartum delivery, you might hourly check their glucose, but that wasn't specified in the answer choice, so don't read into the answer choice. You see what I'm saying there, everybody?
Mm-hmm.
Okay, perfect. Sorry, I knew there was something I wanted to say, and that's why I was like thinking, right, hit next. I can't go back. There's no way to go back. So this is, you gotta put it in order. Okay, so, this is fine, it's fine. So, I put this in there because this may be a question, like, it wouldn't be like, put it in, I mean, we do have those types of questions, alternate item questions, but it may be saying, you know, what is the first thing you do, or during the OGTT test. So first you give the 50 grams of sugar, you wait an hour. If their sugar is within normal range, which is like 70 to 115, I think, around there, or 110, I can't remember if it's 70 to 110 or 70 to 120, somewhere close to it. Then they're good, they get to go home. But if they're still above range, then you do 100 milligrams or 100 grams of sugar and wait 3 hours and then check it, and then hopefully there's still more things that could happen. If that test is bad, if that test is elevated, then they do have gestational diabetes. Does that make sense? Okay. Good job. I'm glad you guys knew what I didn't want to have to write out all the freaking P's. I was like, that's just too much typing. So yes, visual changes, recurrent, very good, very good. Alrighty, zombie. But watch out, all these people are like coming after you. Okay, so multi-professional treatment plans. The reason that I put that in there is because whenever you're dealing with gerontological patients that have diabetes, they always will have they almost always will have other comorbidities. So that's why it's important to use a multi-professional team for their treatment plan. And then decreased cognitive performance. So as you age, you know, I'm from the South, okay, so I would say, well, you know, he's just not firing on all those cylinders or something, you know. That was what I would say. I don't know if that's probably not politically correct, but I'm from the South, so there you go. But, we know that our cognitive function tends to decrease as we age. So, since that is an issue, then you have to be more diligent with patients of gerontological age. Okay, oh, I forgot. Okay, so I have three. I had my husband diabetic, dad number 2 diabetic, dad number 1 was diabetic. I forgot about that. He passed away about 5 years ago. But anyway, he had a stroke when he was 52 and I had to start taking care of him. And I was pregnant with my daughter. It was a great time. I mean, we had to work on learning. We had to learn how to reuse the microwave and put the toilet seat down and use our forks. I did a lot of OT therapy and then I'm pregnant, so it's just, you can see how this could be traumatic time in my life. But anyway, he was able to get well enough to live sort of on his own and so on and so forth. But anyway, so for him, since he had those strokes and his cognitive impairment was very decreased, I had notes everywhere, like all over the house, like by the fridge, you know, because when you finally were able to put them in an apartment, I had notes by the fridge, you know, don't forget to eat lunch, don't forget, what about dinner? Or, you know, in the freezer I had dinner and then down I had lunch. Or then I would have by the door, if you wanted to go out. Did you get your glucose tablets? You know, make sure he put them in his pocket when he was leaving, because he had a little scooter and he would go driving around down like 380, like he lived in an older area, but there was like a lot of little shops that he could go to and restaurants and stuff. So, you know, I would call him, and as this new technology, I forgot the name of it, but there was a technology that it would even call you and like remind you to take your medicine. It was like some automated thing, but still, hey, it helped. So you have to do a whole lot of reminding and re-reminding. So even with all the information that I would tell him about his diet and what to eat, about every year we would still go back and see the dietitian, and she would talk about the things that you should do, like eating wise, because you know, you kind of like, you get out of the habit and then you go back to all those TV dinners with all the sodium, and then you just need like a reminder, or, you know, that kind of thing. So that's an important issue when you're dealing with gerontological age. My joke was that I'll get a suite in heaven instead of a regular room, since I took care of him for such a long time. And when I was pregnant, oh my gosh. Sorry. Okay. Good job, Hermione. I'm a fan of Hermione, whoever you are, just because of your name. So, you can use the 2-hour OGT level if you have above 200. That is a diagnostic test. It is used more often in gestational diabetes, but it still falls under a true statement for this. So, you know, think about it that way. Remember, when you look at the answer, when you look at the question, you read the question, you reword the question in your mind. So basically, I usually take the lower half of the question and flip it and put, so like if it says, the nurse is taking care of a patient with blah, blah, blah. what, blah, 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 should the nurse expect? So I would say, what do I as the nurse expect to see for this patient with a blah, blah, blah? See what I mean? I just kind of flipped it. So it made sure that I understood the question being asked before I looked at my answer choices. Because if you look at your answer choices before you've read the question, you might already send your brain in the wrong direction. Is that making sense? Okay. So then I'll even come up with a answer like excessive urination. I don't know. If that would be like this sign and symptom I would see for whatever disease process. So, and that's just another help to make sure that I'm on the right direction when I start looking at my answer choices. And the reason I do that is because I don't want to go back, I don't wanna be wishy-washy, I wanna make sure I understand the question, look at the options, pick the right choice, and move the freak on, okay? Because NCLEX does not allow you to backward navigate. You cannot backward navigate in semester 4. I can't remember about semester 3 or not. Truly, backward navigation is a hindrance to you because you tend to make more mistakes if you teeter-totter and flag it and whatever, than if you just clearly answer the question and move the freak on. Okay? Sorry, there's a little soapbox I have to say. Okay. So what is our A1C? Oh, that was the 21, never mind. Random or casual blood glucose level above 200, but see, I put in bold plus symptoms. So, that is a determination for diabetes. So you have to have those two things together to correlate, you know. All right. So how long is the RBC lifespan? Good job, people. 120 days, that's why you can't cheat that test. My husband is funny, he's like, he gets to go see the doctor, I need to eat right. I'm like, honey, it doesn't matter what you're just doing right now. She's gonna know. Okay, so this is where you can type things. I know it's different, but I'm trying different things. Everybody answered? No. They got to me. I gave you guys lots of time on this one tonight. Is it working when you're using your phone? Can you like type on that? I'm just wondering. Okay, then how do we show answers? Nice, okay. Diet. So diet and exercise, I think, is the two answers that works for almost every disease process, but that's me. Education, safety, prevention of the, yep, that's great. Better nutrition, education on diet. Compliance, yes, we have issues with compliance for sure. Within normal limits, yes. I like the term within desired limits because that notes that there is a specific number that you have to say what that number is, so that's why I like WDL versus WNL, but that's just me. Lower the A1C, making sure signs and symptoms, doses on the current monitoring. Yeah. That looks really good. Okay. So, the reason I chose those two wrong answers is because you can have cake with your dinner, but you have to carb count, okay? So it's 30 grams for snacks times 3, and then your meals, breakfast, lunch, dinner is 45 grams. We'll talk more about that, I believe, in nutrition is when that comes up. But since you may have 1 or 2 questions on the diet that are things that pertain to diabetes on this test. Used to be metabolism and nutrition were in the same test, so it made it easier. But anyway, so you just have to make sure that if you want your cake, then you just have to lay off the mashed potatoes. Alcohol can be given, and I know it's funny, right? But it's true. I'm a fan of mashed potatoes. Any kind of potato, except sweet potato, but any kind of regular white potato, I'm all about it. So alcohol can be in moderation. So if you want to have your glass of red wine, then you can't have the cake though. So you gotta like pick and choose because some of those alcohols do have alcohols, what I used to call them. Some of those do have calories, connected to it. But you can't have tons of alcohol because that is bad for diabetes, and I forgot why, but I just know it's bad. But you can have it in moderation. So the reason those two statements are wrong is because you basically say no. Like, you guys ever watch Seinfeld with the soup Nazi? No soup for you, that's what he would say, okay? He was never mind. Anyway, you can't take out those things completely from someone's diet because they will not follow it. So you just have to make sure they understand moderation. Especially in America, we don't understand the concept of moderation. I myself had to have a gastric sleeve because I'm not good with the concept of moderation. So, yes, so that's why those are there. And then, a good idea for the small snack before bed. What kind of snack do you want them to have before bed? Complex carbs and a protein. So that's why like peanut butter and crackers with like the wheat, maybe the wheat side of the crackers would be great. Or, it could even just be something like carrots with some ranch dip. It's got some fat in it that'll help. It slows down the the absorption. So, so you would want a complex carb and a protein would be the best choice. Okay, and yeah, we all know we gotta check our blood glucose before meals. If you check it after meals, it's not really gonna do anything. Okay. Jack Skellington? Who is that? Skellington. Oh, see, I haven't seen that movie. Okay, multi-select. diverticulosis was something I just pulled out of a hat. So, neuropathy, peripheral neuropathy, and glaucoma. What is the commonality between those three? Macrovessels. So macrovascular, thank you, macrovascular disease processes and macrovascular disease processes is a very big problem for diabetes. I have a little picture later when I'll talk about it more. Maybe it's here. Okay, yep, I'm so good. Okay, so this is actually not a sugar crystal, it's actually a pollen molecule, but I like it for a visual because this reminds me of what sugar is doing as it's traveling in the vessels all throughout your body. So if you think of a sugar crystal, it's probably got like jagged edges like this pollen molecule looks. No wonder they cause so much problems in our nose, right? But anyway, so it's going through the vessels, it's going through those little capillary vessels, it's traveling all over the place, and there's excessive amounts of those glucose crystals all through the vesicles and, you know, all those tubules, and that's why you have so much damage when you have those high levels of sugar in your blood. So that's why I have this picture here. So that's why when you have microvascular damage, it's because those little bitty vessels, you have those, and they're just like bebop, and imagine they're like just bouncing around on those vessels and just like ripping them and tearing them, and then you get little scar tissue that forms on those little vessels from the rips and the tears, and then other things come by and they like stick to it, plaque will stick to it, and then the plaque builds up more and more and more, and then you still have those sugar molecules bebopping around. I mean, because then it causes the inflammatory response to occur, right? Because we have made little rips and tears in our vessels. So you see how all those things like build on top of each other and snowball, and that's why you have the micro and macular vessel damage. So is that like you understand the visual that I'm going for here? Okay, cool. See, I know I do that every time. You know that I have a thinking process when I say the things and then I ask the question. Okay. So, maybe it's because I've used the word acute complications. That's why you didn't pick those two. That could be it. So, let's just say, but we'll just say these are complications, okay? Well, so that's why I probably should have added the word acute.
So that'll be more acute.
No, wait, that is right. That's right. I thought I had picked all four of them, but I didn't. Okay, good, yes. Yes, okay, good, okay. Never mind, I'm sorry, I had a brain fart. Okay, so yes, so the micro and the macrovascular damage occur and over years and years and years of time. So, already I'm like hot. Okay, it's too hot in here for me to wear this freaking mask. But anyway, neither here nor there. Okay, so, and so what organ, no, I think that's a question later. I'm not gonna say it. Okay, so I said, technically, you could say that that the blue one is correct. I'm not saying it's not totally correct, but it's really, this more specific, more correct answer is a profound deficiency of insulin.
All of these are correct, but this one is the most correct.
So if I had this test question, I would give back answer choice blue, okay, just so you know. But, okay, I don't know if I'm gonna add, and the reason I had the puppy dog on there is because one of my dogs, Charlie, he was a lover of food like me, and he ended up, well, the doctor said it was DKA, but maybe it was HHNS, and I didn't know it, but anyways, he ended up with DKA. I didn't know he had diabetes, cause I have 5 dogs, and I don't know that he's peeing and eating a lot. I mean, I can't tell, like, you know? And it's not like I can ask him, you know, these questions. So, I don't know. Anyway, I had to put him down when that happened, so, but anyway, so that's why I had to, you'll see, I have little dog pictures all throughout here, and Charlie was a King Charles Cavalier Poodle mix, so, yeah, anyway. I have an affinity for animals. I don't care so much about humans, but I do love animals.
Before you go on to the next question, I need to recall.
Oh, okay, sure. I don't know, what was I gonna say? Oh, organs, I'll say that. So what organs do you think, are severely affected by having high glucose levels in your bloodstream?
Pancreas.
Kidneys?
Kidneys.
The what?
The heart.
Probably. That's not one that comes straight to mind, but I'm sure it's affected in some ways, yes. But the kidneys especially, because if you think about the kidneys, it's a big filter, okay? And it's going in and out of those glomerular tubule, the glomerular filtration rates go in and out of those little tubules. So you're just like, it's like a sponge. It's like a really awesome sponge, sort of microvascular thing. And that's why those, it just rips it up when it's like bebopping around in there. So, anyway. Okay, did you get reconnected? Okay. Hermione, nice. Okay, good. Good, so severe dehydration, you still have severe dehydration with DKA, but you have super severe dehydration with HHNS, so I see why you were a little hesitant to pick that choice. And further thought, I said microvascular things, that's why I was focusing on the kidneys, but macrovascular does do a lot of damage to the heart. The sugar does do a lot of damage to the heart also. It's that because I remember it was atherosclerosis, because I said, you know, you make those little nicks and stuff in the vessels, and then the inflammatory spots happens, and then the plaque grabs onto things, and then more grabs on, and that's atherosclerosis. You know what I'm saying? So you were right. I just wasn't, I was thinking microvascular, and that's why it just didn't hit me as much. I apologize. job. So yes, Lantis is not part of your immediate emergency management of DKA. And, okay, so let me ask you a second. I said a regular insulin drip. Can you infuse any other types of insulins in it? No,
No.
you can't. Okay, good job. Only regular insulin can be in a drip. And yes, large bore, we're talking about 18, maybe even 20 gauge, IV access for those people. See, there's my little binder tray. Okay, so DKA is more common than HHNS or HHS. But as I said, I feel like you will see more of this on the rise as our elderly population ages and so on and so forth. Okay, yes, and we see it in our older adults, but we don't have a ketosis, that doesn't really occur much. And then severe dehydration is our main issue. Good job. 3 players, nice. Okay, that was when I was trying to follow the PowerPoint that says blood glucose above 400, but it's really blood glucose above 600. Okay, perfect. I just need to remember to change. So yes, you will a lot of times see elevated serum potassium, but remember I explained how that might not really be true if you look at the total body. And the serum osmolality will be very high. Good job. So not taking your diabetic meds, that would cause hyperglycemia, and all the other ones are good. Oh, I said this again. And look, I picked that picture because it was like, it looked like a nursing student. I had to wear an outfit like that with the white shirt with the blue stripes. And I had to wear white pants, so you guys should be totally happy that you don't have to wear white pants. So headache and numbness and tingling, that's more, on the other side.
So this guy has infection, which is huge. He's probably got like he could have osteomyelitis, or if not, at least he has probably has a real bad decubitus ulcer on his right foot. So, yep. That was just me imagining the person. Yes, pH, you don't see a big pH shift on HHNS like you do DKA. Good job. Good job, people. Hold on, let me write one thing down while I'm thinking about it. Okay. Alrighty, yes, the treatment plan for both of them are very similar. So re-education needs further understanding. So we're looking for the wrong choice. Okay, well, I didn't mean to. Okay, so look what. I'll go back in and fix it. I'll look at the time. Okay, so it defaults at 20 seconds. And I finished this last night at midnight, and then there you go. I'm sorry. Okay, so it's not hypertonic solutions. It would be normal saline, which is isotonic, because you don't want the fluid has already shifted out of the cells into the vessels, and you don't want to make that happen further. And that would happen further if you gave hypertonic solutions. So normal saline is 0.9%. What would cause the RN to caution this order?
What's the
trying to
yellow
say.
saying?
Potassium 3.1.
The calcium level of 3.1.
Dang.
Sorry, people.
I can't
Can't
read
see
it.
it.
I need to turn it. Let me.
It's just hard to see this side anyway. I'm catching some of them not.
Yeah, that yellow's the only one I can't see. Yeah, that's
just can't, I can see, like, you can see some of it, but not.
Yeah, so if our potassium level is already low, because that is the level of our serum potassium, then where our total potassium is probably even lower. So that's why we don't wanna send them into, cardiac, thank you very much. We don't wanna make it worse, so that's why we would have to caution the order. So maybe we would have, we could, maybe, I should have had like just regular normal saline in there. So you would maybe say normal saline with 20 milliequivalents of potassium to be given. And then recheck the, potassium level every 2 hours or 3 hours, since they're so critical at that moment. So yeah, so does that make sense? Okay. Thank you. Sorry, Kizzy, just be sure to tell me next time, I forgot. I can see it just fine, because I'm up here. And I'm looking here, so, you know, I don't know. Macrovascular damage. So this characteristic, through things related to, sorry, I know that question was kind of confusing. So women are at higher risk for, what I was trying to get at is to tell you this, women are at higher risk for macrovascular damage caused by diabetes than men are. Okay? That should be atherosclerotic process, should be 2 separate words. Let me fix that. 33, I'll fix number 33. Again, I'm sorry, it gets, you can tell it gets worse. It gets worse as the night goes on, and I'm sorry. I really started this like 4 days ago, it just, you know, things happen. I usually would say another word, but I'm in class. So, yes, the atherosclerotic process occurs, which causes the macrovascular damage in diabetes. So when you have a person, to control micro and macrovascular damage, you want to more tightly control their blood glucose ranges. Okay, so angiopathy of large and medium vessels. So that's basically the definition of macrovascular damage. Microvascular. Yeah, good job, people. So it's, and yeah, you wouldn't think about the skin, but yes. Because I guess when you think of skin, you don't really think about like, I just think about like dry skin or eczema or something, but when you think about the skin and macrovascular damage, that's where you have your neuropathy that occurs, because the vest that's all like in the skin level, the nerves are all at the skin level, and you get your pressure ulcers and all those kinds of things. And that's all macrovascular damage. I know this is one more, type your answer, but don't forget there's only 2.
everybody? Well, how fun. Oh, I guess those were wrong. They were technically right. It asked me to put like 4 correct answers, and it wouldn't let me put more, so I kept trying to put like different variations of diabetes. But yes, it's diabetes. It's diabetes, as my daughter would say.
That's how my son says it too.
Oh, really? Yes. Which is interesting, because I would have thought that hypertension would have been the number 1 cause. But I guess maybe it's a close second or something. Yes, so ACE. So I told this to Kizzy, I don't know if this will help you remember, but I have little things to try to remember, like what a drug is to the class. So mine is for ACE inhibitors. So ACE, he's like this, like, you guys, I don't know, was there a show called Friday Night Lights or something? But he's the quarterback of the football team. He's just awesome at sports. His nickname is Ace. But he thinks he's all that in a can of whatever, I don't know. He's all that in, what is it, bag of chips? Is that what it's called? There it is, bag of chips. So he's a prick. / Pril. See, lisinopril is an ACE inhibitor. So you see how they're, I don't know. It works for me, okay, it works for me. And then beta blocker is just like, there's the LO with beta blocker and the OL. There's an LO with those, the metoprolol, all those. Okay, so anyway. But ACE inhibitors are specifically good for nephropathy versus other medicines, and I can't remember why, but it's in your book if you want to find out why. There's only X amount of brain power that I can have to hold things in, and that just got thrown away. Okay, yes. So, what does gabapentin do for neuropathy? Yes, it helps with the nerve pain, good job. Capsaicin, that's a topical cream that you can use, it will help with, nephropathy. And then those SSRIs and the tricyclic antidepressants, I can't remember why, but I know they do. There you go, okay, I can't remember why. Huh? Maybe, I don't know, I feel like there's something else, like, there we go, thank you, I was like, I feel like there's something. Did you hear that? They work with the pain receptors, so they're given for things like fibromyalgia and things of that sort, so it's a nerve issue. Thank you for this focus. Okay, good job. So apparently, I used to always use the term sick day protocol, but I have not seen it in the books recently. So they still say that in home health. Okay, well, I don't know. That was always like a thing that I remember, sick day protocol. Anyway, so you want to more frequently monitor your blood glucose levels because your the stress mechanism, the corticosteroids are elevated, infection loves sugar, you know, all those things. You wanna increase fluids, but if you want something more than water, then, you know, do like Crystal Light or something. You don't wanna take in a whole bunch of calories. Like, this would not be the time when you would load up on 4 Gatorades. Maybe the 0 sugar Gatorade version, but not the full strength version. And then you don't want them to think, oh, I'm not eating, I shouldn't take my diabetic meds. No, that's not true, because of the release of the corticosteroids and so on and so forth. But you don't hold your insulin administration. Now, if you're really like nausea and vomiting, you may call your doctor and they may have you to take half of your dose of whatever medications that you take, but you never hold all of it. See what I'm saying? So, that's why ultimately, circle back again, you have to frequently monitor your blood glucose when you're sick. So the reason I put this one in is because this is a standard NCLEX question. You will easily see, and it could easily be a question on your test, because metformin and contrast is muy no bueno.
Is it prior to surgery also true?
It's prior to all surgeries is no. It's prior to surgeries where contrast is a possibility. It's really, the contrast is the problem, not the surgery itself. So that's why I worded it that way. Whenever you see all or none, that's usually not the right answer. It's usually never all and none. It's not always, and it's never, never. Okay. One more question. And then I was just out of questions, I couldn't think anymore. And I thought 40 was a good number. Oh yes, there's the other one, this is an order. An RN, that is there to help you answer this question. You just don't want them to ever touch, but you always, so you put, first you put air and NPH, you put air and regular, you draw up the regular, and then you draw up the NPH. So, RN, yes. So, draw up the regular, and draw up the NPH, and then you can figure out the air part.
Air and NPH, air is the regular, draw the regular, then draw.
And I've never done, just so you know, I have never done this in practice. Never, never, never. So, basically, it's those 30-60, 30-70, or 60-40 mixes that you see, but this is, NCLEX loves this test question. Because, you know, I mean, maybe, you know, there's fallout, of electricity, and we have to go back to the basic vials of insulin. I don't know, you know, I don't know what's gonna happen. Maybe, you know, maybe it's zombies, like, I don't know. There you go, there's a, yeah.
That's actually true right now.
Oh, really?
Yeah.
Oh,
There's a needle shortage.
oh snap. There's probably a shortage on everything. I have had a hard time for like a few months finding Worcestershire sauce. And I love that. I'm a fan of Worcestershire. Me, oh, I'm a fan of Hermione. Frankenstein, woo-hoo! Oh, zombie in the book. Okay, people, so let's take a 15-minute break, and we'll come back